The
Good
event
evening,
is live.
and
You're in
welcome
a
to our
view-only
virtual
role and
panel
cannot be
discussion
seen
on
or
pregnancy
heard.
and the pandemic for pregnant mothers. My name is Dr. Jane Glasgow, and I am the Executive Director of Minus 9 to 5. We are a collective impact initiative that works with community partners and agencies to coordinate and align efforts and support children and families prenatally from the minus 9 to age 5. Bringing together key stakeholders around community needs and working together to create solutions not one of us could do by ourselves is exactly why we exist. Today's presentation is a great example of how we bring folks together to address a need. We are excited that you're going to be joining us today for our panel on pregnancy and the pandemic. You'll hear from some of our outstanding EVMS physicians and our partner medical personnel from other organizations and have an opportunity to learn from them and have your questions answered. Just a couple of housekeeping items. Audience members are all muted and have no audiovisual capabilities. We encourage you to share questions as you go. If you've joined us through the Blue Jeans event link, you can use the question and answer box to type in your questions. You also have the opportunity to type questions in the comment section on Facebook Live. We'll answer questions after we've heard from all of our panelists. And if you see a question that you like in the chat box, be sure to hit the like button so that we know that's an important question and it'll rise to the top. We want to make sure we answer those most pressing questions. And now I'm going to hand it over to Dr. Cynthia Romero to start with our panelist. Thank you.
Hello, everyone. On behalf of Dr. Richard Homan, President, Provost, and Dean of Eastern Virginia Medical School, we welcome you and thank you for joining us tonight for this session on pregnancy and the pandemic for parents. I am Dr. Cynthia Romero, Director of the M. Foscue Brock Institute for Community and Global Health at EVMS. The Brock Institute collaborates within and beyond EVMS to provide education across the region to improve the health of our community. We are grateful to work with Dr. Jane Glasgow and the Minus 9 to 5 partners to prepare this program for you, pregnant moms, as well as families with or neighbors of pregnant moms. To share practical information and provide clinical perspectives, we have gathered a knowledgeable and experienced panel of local experts. Dr. Jerri Waller is a fourth-year resident in the EVMS OBGYN residency program. She will be providing an overview of COVID-19 and pregnancy. Dr. Elyce Berkley is a maternal fetal medicine specialist and associate professor of OBGYN at EVMS. She will be discussing clinical and hospital expectations. Teresita Hammond, RN, is a labor and delivery nurse at Centera Norfolk General Hospital. She will be talking about anxiety and stress during pregnancy and delivery. Dr. Glen Green is a professor of pediatrics at EVMS and a neonatologist at the Children's Hospital of the King's Daughters. He will be discussing nursery care and care of baby for a COVID-positive mom. Dr. Douglas Mitchell is a professor of pediatrics at EVMS and medical director for the Children's Hospital of the King's Daughters Medical Group. He will talk about newborn care in the pediatric office. And Stacey Starsman is a nurse practitioner of Virginia's Center for Women, a certified nurse midwife, as well as an international board-certified lactation consultant. She will be discussing breastfeeding and COVID-19. After our panelists have shared their presentations, there will be a question and answer session facilitated by Dr. Jane Glasgow. Let's begin now with Dr. Jerri Waller.
Hi guys, thank you so much for having me today. My name is Jerri Waller. Like Dr. Romero mentioned, I'm one of the fourth-year residents at Eastern Virginia Medical School. And I'm just going to briefly go over COVID during pregnancy. So COVID, as we know, is a respiratory viral illness that's spread from respiratory droplets from close contact with infected individuals. Patients may be symptomatic or asymptomatic. Symptomatic patients may have fevers greater than 100.4, difficulty breathing, shortness of breath, cough, chills, muscle aches, headaches, sore throat, new loss of taste or smell, or GI symptoms. These symptoms can take up to 14 days after exposure to arise, and the median time for symptoms is 4 to 5 days. So the best way to prevent the virus, as most of us know now, is to practice social distancing and adequate hand hygiene. So this includes washing hands for at least 20 seconds with warm soap or water, or if no soap is available, using an alcohol-based cleanser. You want to use about 60% alcohol. You want to avoid touching your eyes, nose, or mouth, and stay at home as much as possible. However, if you do need to leave the house, you should stay at least 6 feet away and avoid people who are sick. Mask wearing will help decrease the risk of transmitting the virus to someone else. Currently, there's little data to suggest whether or not pregnant individuals are at increased risk of infection or severe morbidity. Most will say now that they're at the same risk as the rest of the population. However, those pregnant patients with other comorbidities such as diabetes, high blood pressure, asthma, other illnesses may be at higher risk. And as we know right now, there's insufficient data to show any sort of vertical transmission or transmission to the baby from the placenta or in the uterus. So if you think that you may have COVID, the first thing to do that your physicians may do is kind of assess the severity. So they want to look at whether or not you're having any difficulty breathing or shortness of breath. Are you having difficulty completing sentences or walking around without gasping for air? It's normal that pregnant patients may have shortness of breath during pregnancy, but is this more than usual? Are you coughing up blood or having new onset chest pain or unable to keep food or liquids down? If you do have it, then they may request that you're seen as soon as possible in the ambulatory setting. If you're having any severe shortness of breath or difficulty breathing, then they'll have you assessed in the emergency room as soon as possible. They may monitor your blood pressure, heart rate, oxygen level. They may perform a chest x-ray to look at your lungs or take some blood to look at the oxygen levels. It is important if they do recommend that you are seen in the emergency room, that you let them know ahead of time that you're coming and what your symptoms are. That way they can adequately greet you, make sure that you're isolated in a room and not left in the waiting room where you could potentially infect other people. We also know that among patients that develop severe disease, the median time for shortness of breath was 5 to 8 days. Patients that developed respiratory distress, the mean time was 8 to 12 days after the onset of symptoms. And patients that ultimately required ICU admission, the mean time was 10 to 12 days after symptoms. It's important that your doctors are aware for some potential for some patients to develop severe respiratory compromise and to make sure that they're monitoring you appropriately. As mentioned before, mother-to-child transmission during the coronavirus is highly unlikely during pregnancy. However, we worry about the newborn that is susceptible to person-to-person spread following birth. The pediatricians will be talking about that more later on. How we can recommend our patients stay healthy now. You want to eat healthy, well-balanced, and nutritious meals. Exercise regularly, also at home if possible. Getting plenty of sleep. Avoiding alcohol or drugs. And some may suggest breathing exercises to even help your mental health. So breathing in for 4 seconds, holding for 7 seconds, and breathing out for 8, and repeating that a few times. That is all I have on a quick overview of COVID and pregnancy. So I will turn it back over to Dr. Romero. Thank you.
Great. Thank you so much, Dr. Waller, for that very informative overview. Again, those who are watching, please know that we welcome your questions. So please use the chat feature on your live stream platform and submit your question, and like those that you see so we can address them during the question and answer session. Now let's hear from Dr. Elyce Berkley.
I think Dr. Burke may be having some technical difficulties, so we're going to ask Dr. Waller to ask for a few minutes until able to see if Dr. Berkley can join us. But we will have Dr. Waller talk a little bit about the clinical and hospital expectations. As we know, she's been in both the clinics and the hospitals quite a bit lately.
Yeah, so I'll go ahead and get started about the hospital, and then if Dr. Berkley jumps on, I'll let her talk about the clinic. So when someone presents to the hospital, whether or not you think that you're in labor or you're there for an induction or C-section, when you first walk into Norfolk General, you'll be greeted at the entrance where they will assess whether or not you've had any symptoms or recent fevers. At that time, once they assess your symptoms, as long as you haven't had any symptoms, then they'll go ahead and send you up to labor and delivery. Right now on labor and delivery as it stands, we're allowing one support person along with the patient that is to remain there the entire time. And after your triage visit, or if you are admitted or induced or scheduled for your C-section, we will test you for COVID prior to beginning. So this is for a multitude of reasons. One is for the staff to maintain that safety among the staff within the nurses and the physicians who are taking close care of you. Also to make sure that you are being taken close care of if you need to be paid extra attention to make sure that you don't develop any respiratory distress after delivery, as well as for the pediatrician's knowledge so that they can make sure for the baby as well. During the induction process, if you are tested COVID positive for the virus, I believe, and Teresita, you can correct me if I'm wrong, that they may not allow visitors at all. Is that correct?
Yes, that's correct.
The other thing that we ask during labor and delivery is that whenever a provider is in the room, regardless of whether or not you test positive or negative for the virus, that you wear a mask at all times. That's to protect, we will be doing the same. That's to protect both of us, the providers and the patients, from any sort of viral illness. Following delivery, you should have the same experience on postpartum, where you will again be asked to wear a mask anytime a nurse or physician is in the room to both protect yourself as well as your providers. But ultimately, even though that the amount of support people that you can have available with you at the time of labor and delivery has decreased, know that your care has not. In the clinic right now, things are kind of changing. So as the city and state is starting to open back up again, our policies are changing a little bit. Previously, the schedules had been diminished significantly, where we were trying to do as many telehealth appointments as possible. That has sort of changed, and you may notice that rather than doing a telehealth appointment as you were previously scheduled, they may try to start seeing you in the clinic again. But ultimately, again, regardless of whether or not the care is via video chat or in person, know that the care that you're being provided is the same. And again, during your clinic visits, they may ask you as well to wear a mask when you enter the clinic in your room with the provider and the nurse.
Great. Thank you so much, Dr. Waller. As we're waiting for Dr. Berkley to connect, if it's okay with you, maybe we'll move on to Teresita Hammond, who can talk to us about the anxiety and stress during pregnancy and delivery. Teresita.
All right. Hello, everybody. Pregnancy, as we know, it's an exciting time. It's a vulnerable time. It's a scary time. And with this pandemic, it just added extra layer of stress to you. But you should know that we are going to take very good care of you when you come to the hospital. Yes, you do only have one person that could be with you, but that does not diminish your experience at all. As a matter of fact, I feel like most patients have told me it helps them bond more closer with their support person who's there. That support person can be anybody that you want. It could be your significant other, a family member. Some people have their doula. It could be whoever you need to help get you through. Also, if you have a birth plan, or if you have your plan is to have an epidural, whatever it is, we're going to be there to help support you. There are some things that you can do if you want to have like if you're doing natural, or if you want to have like essential oils, we can do essential oils. If you need to kind of walk around the room, your baby looks great, you can walk around the room. We have birthing balls. We still have anesthesia available in-house if you want that epidural. We still are going to provide you with the same care that you were getting pre-pandemic and post-pandemic as we open up. And then some things that you can do at home just to kind of help relieve the stress, because you're used to family, friends being around, having baby showers. Social distancing is still important for you and your baby and your family and everyone around you. So the way you connect is just like what we're doing here, using Facebook Live, Zoom, connecting on the telephone. Those are all still very important. Making sure you're walking around, getting exercise. I'm outside here on my sunroom because I love planting, found out that. Do whatever you need. Find a hobby, rediscover a hobby. It's up to you, but you try to move around as much as possible. And if we all do our part, hopefully we can get this behind us and be safer and healthier for the better. Back to you.
Thank you so much, Teresita. Doesn't everyone want to have a nurse like Teresita by their bedside when they're going through labor? I certainly would. Thank you so much, Teresita. Really appreciate that. And we'll check and see if Dr. Berkley was able to join us yet. Okay, we'll continue to move on. And now we'll have our next speaker as neonatologist Dr. Glen Green, who again talked to us about nursery care and care of baby with COVID-positive moms. Dr. Green.
Hello, everyone. Not seeing my picture yet, but I'm going to give a little brief presentation for you, and we can put that up if you want to, Joel. We're waiting for that to be put up. It sounds like I'm going to do a little talking. So there we go. Just want to let you know we are the neonatologist is also all of our neonatal hospitalists and pediatricians that will be providing care for you in the hospital are going to do our best to make this a pleasurable experience for you. Let's start with the next slide. All right, the newborn, as you heard a little bit there, it remains unclear if it really is transmitted from the mother to the fetus through the placenta into the womb. At this point, prior published experiences, particularly respiratory viruses, would suggest it's unlikely, and so far we do not believe this occurring. The newborns are at risk, though, for infection from a symptomatic mother with respiratory secretions after birth, regardless of their delivery mode. There's what we're going to be talking about. Next slide. So the management is that mom and baby are, unfortunately, if you are COVID positive, then we are recommending that the baby separated. That means that's temporary separations because we do not want your infant to become obviously infected. This will happen right after birth, and the baby will be taken to the nursery. Next slide. So we are going to, when the baby is in the nursery, a designated limited care caregivers will be assigned the infant. So we're again trying to minimize that. The baby's going to be bathed as soon as reasonably possible, again, to try to make sure nothing has occurred on the skin as well during the birthing process. You will see people will be wearing their N95 masks, eye shields, gown, gloves, and all that so that we can obviously take care of our baby and protect our staff. Next slide. Now, the baby will be tested the baby will actually have 2 consecutive tests with 1 single swab. They use the throat and then the nose, where they'll be collected at 24 hours and at 48 hours. They collect the first test at 24 hours is to avoid in case there's a transient, we call it colonization. It just means it's not infected and not truly there, but we want to make sure when we get a test that it's actually reflecting an infection or not. So at 24 hours, we'll be doing that, and then at 48 hours, we'll be doing it as well. Once we get those results back, we can then determine whether the baby has actually acquired any infection at that time. Next slide. So there is an alternative for newborn care, and this is where we talk about if you do not have your baby separated. Now, I have to put a caveat in there. This has to require that the facility you're in actually has the room capability to be able to remain 6 feet distance from the baby and you. The breast milk feeding, we're going to talk about a little bit here later, but the baby will be placed in an incubator or in rather than in a bassinet, and there's that, or there'll be a physical barrier such a curtain between the baby and you to avoid greater infant protection. We're doing all the separation to try to protect your infant from getting this infection. That's what we're doing. But if we do not separate, we need to take these precautions. And again, certain facilities such as Norfolk General, and unfortunately, I know it's into a Careplex, we do not have a room, if you're COVID positive, that will be able to do this distance separation and these precautions. So your baby will need to be separated during this time. Next slide. So if you do have that capability of being able to have your baby and request a skin-to-skin contact, or you want to directly breastfeed your baby, we need to comply with strict preventive precautions. This includes the mask and meticulous breast and hand hygiene. Next slide. So breastfeeding, I know we're going to talk about in a little bit here in more detail, but to date, no study demonstrates the presence of the virus in the breast milk. So moms, we recommend that the breast milk, you express that breast milk after the proper breast and hand hygiene, of course, and then this milk will be used and fed to the infant by a designated caregiver. Breast pumps and components are thoroughly cleansed and washed, as we're going to talk about a little bit later here as well. In addition to the known benefits of breastfeeding, mom's milk, of course, is going to potentially provide some protection, since you may have some antibodies that may get into your milk and help protect the baby. Next slide. Visitation, as we talked a little bit earlier, is no visitation allowed to the newborn infection status. The only exception would be as the non-maternal parent, obviously not you, mom, if you're COVID positive, but the parent will visit the infant, participate in the care if they're asymptomatic and they're being monitored for infection due to the exposure to the mom. So we will be taking precautions as well. Next slide. So if the newborn is not infected, as we've done those tests, and is being required to stay longer, unfortunately, it may be not a routine delivery, but having a little extra stay with us in the nursery, your mom, you are, again, this would be someone who is maybe a preterm infant who's going to require several weeks in the nursery. The mom will be able to visit, but only after she meets the CDC recommendations for suspending these precautions. And those are listed there as no fever, without any kind of Tylenol or Advil or anything or antipyretic, that you have improving your illness and symptoms, and you've actually had 2 negative tests. So these are 2 nasopharyngeal and throat swabs that are done greater than 24 hours apart, and both are negative. Then that would say that you then will be able to visit the baby. I'm sorry for this, but this is, again, to protect your little infant. Next slide. Now, discharge is, again, where if your infant's determined to be infected, that's hopefully not the case, but if it was, then we have, but still the infant has no symptoms, then be discharged home in an appropriate time, and we'll talk about that as a case-by-case basis. Now, the infant whose infection status was generally negative, and you can go home. At this point, we really would like to have a designated health caregiver who is not under observation. The person with you, if you have COVID positive, that person with you will be a person under investigation and would not be the person we recommend. We recommend someone who is not, as they say, under observation for any COVID-19 risk, be the care provider to take care of your infant. again, we need to talk more about this, so we'll manage this by case basis as this comes up. I think that's it. I'm happy to answer questions as you may have them. Back to you,
Great.
Cynthia.
Thank you so much, Dr. Green, for that very informative presentation. Again, for those of you who have questions, feel free to type in your question using the chat feature on your live streaming platform and like those questions that you already see so we can address them. We'll pause to see if Dr. Berkley is on the line yet. And I know she's wanting to get on and join us. So we'll go ahead and move on to Dr. Douglas Mitchell, who is a pediatrician, and he'll talk about newborn care in the pediatric office. Dr. Mitchell.
So I'm on the phone only. Hi, should I start again? Doug Mitchell, thank you for letting me join you. I've also had technical difficulties, so I'm going to have to trust that Joel is able to bring up my PowerPoint, my slides. And we can go past the introductory one. Joel, let me know when we're on slide 2. I'll go ahead.
Good to go.
Fantastic, thank you. So the first thing is Dr. Green did a great job of describing what you can expect during this in the hospital. Following discharge, it all comes down to basically if the baby's healthy and if mom's healthy, then as far as we're concerned, it's regular newborn care. And what we want to reassure you is that we're going to do everything in the pediatric offices to keep all the caretakers, moms, fathers, and the baby safe in the offices. So in our offices, we're screening all patients, all visitors to all CHKD facilities are being screened. That includes watching for fevers. We're limiting the number of people at the appointment so we can avoid spread. Our offices are separating well and sick visits by the location of the office or by the time of day. Most of the offices are doing well checks in the morning and then doing sick appointments in the afternoon. So then we've got overnight cleaning of the facility prior to bringing well children in the next morning. All staff are being screened for symptoms and for fevers every day when they report for their shift. All staff in the CHKD facilities, and I think this applies to Centera as well, are being required to wear masks as we're seeing all patients and as we're interacting with each other. Then this again is to protect the staff and also protect our patients and each other. We are setting every one of our clinics up to do the social distancing or physical distancing in the waiting rooms and in the lines. For example, for the most part, we don't want people in waiting rooms if at all possible. We'll get you registered and either back to the car or immediately back into an exam room so we don't have waiting rooms full of people. We're doing all of the CDC guidelines regarding exposures, and all of our information is available on the chkd.org website and other places. Next slide, number 3, please. Remember, the pediatric impact of this virus is relatively minor. Yes, there's more information coming about this toxic shock syndrome or multi-system illness in children, and younger children and over 15 seem to be at risk, and the other children don't seem to be quite as at risk for this. But in general, for the vast majority, COVID is a relatively minor illness in children. We do want to prevent it as much as we can. I also recognize that all of our shutdown, our stay-at-home orders have decreased the spread of other illnesses like influenza. So we've got much fewer sick children and other adults out there. We do have concerns with all the stay-at-home orders that we need to pay attention to, and that is we're missing immunizations in kids that are most vulnerable. We really encourage you to get in and get the well child checks done for that newborn so we can keep on the immunization schedule and protect them from the other diseases that really can be very severe in young infants. Other concerns while we have to stay at home is there are concerns of increasing domestic violence, increased depression, anxiety, And again, the delay in care. For kids that have chronic illnesses, we're afraid that they're delaying coming in for fear and missing the care that they need. Next slide, 4. The things that are normal at the time of delivery: you identify your pediatrician at pre-registration or registration. Neonatologists like Dr. Green will provide excellent care for your newborn in the hospital, and then again, after that, is basically normal newborn care. That includes, just as a reminder, we'll want to see the baby 1 to 2 days after discharge, and there's the person under investigation and isolation. If mom was positive, or if there's been a known contact, we want those known contacts or symptomatic folks to stay home and minimize any potential exposure. So, we want to see the baby, and we want to see the baby with somebody that's not had a known exposure and is not symptomatic at the time they come in, because they're coming in during those well child times in the morning, and we don't want to expose other children. And then after the 1 or 2 days after discharge, typically we'll see the infants again at 2 weeks, 2 months, and then going out from there. And there again, this stay-at-home order is likely to continue for a while, so we need to keep those regular visits going. And part of that is keeping the immunizations, the standard immunization. Sorry, Joel, next slide, 6. Again, making sure that everybody had Tdap, not flu season, so we're not worrying about flu vaccine right now. And then we'll initiate the normal childhood vaccine schedule right on time at the 2-month visit. And again, we want to be able to see you to talk about the things that are other safety factors for the baby, that we talk about safe sleep and no co-sleeping to help prevent SIDS. And we're able to talk to you about the hazards of cigarette smoke exposure to infants and choking hazards and the importance of car seats. So just again, reassurance that the offices are a safe place to bring that baby, and we need to continue those normal well child things. That's what I've got to say. Thank you very much.
Awesome. Thank you so much, Dr. Mitchell. Appreciate that very informative presentation as well. And I see Dr. Berkley is on. Hi, Dr. Berkley. So perhaps we can have you share your presentation, Dr. Berkley. Welcome.
Yeah. Sorry for the delay. Some technical difficulties and just late from work. But happy to join in. They asked me to talk today about the experience in the hospital as well as the office. And so I was going to start with if you were coming to the hospital, and Jerri or Teresita, stop me if y'all have already reviewed this. But as patients come to the hospital, all people, including employees, are being screened at the entrance of Centera. They will be asked questions related to those common symptoms of COVID, and in fact have their temperature taken often to see if there's any evidence of fever that is unbeknownst to the person entering the hospital. On entry into the hospital, it is asked that a mask be worn. Oftentimes, if a patient doesn't have a mask when they get to each unit, it's at the unit's discretion, but a mask will often be provided for you either on entry into the hospital or to the unit. Effective essentially May 1st, scheduling of all procedures for cesarean section or scheduled in deliveries such as inductions of labor. Patients will be tested for the COVID. The screening tests now, we have both a rapid screen as well as a screen that takes about 48 hours. So oftentimes if you're having a scheduled delivery, you'll have screening done 1 to 2 days prior to your entrance into the hospital, so that it won't delay any care or any management in regards to your delivery. if you're a patient that is presenting in labor to the hospital and it is not a scheduled induction or a scheduled cesarean section, or you're coming in to be assessed in a triage manner at the hospital, and you either have symptoms or are planning to be admitted, at that point you will also receive a COVID screen if you haven't been previously screened. The care otherwise will be the same care that you would have been provided prior to COVID, with the normal processes for assessment of patients presenting for any triage concern, or for patients that are presenting in labor or for a scheduled delivery. At this time, I believe the hospital is still recommending on the labor and delivery unit, as well as the antepartum and postpartum units, only one visitor be present with you. So you will have your support person available with you, and the nurses and the doctors hopefully are continuing their excellent care and support, despite the fact that we might be seen behind another layer of wearing our mask and our shields. But the care is the same. And I think most patients presenting so far over the last month to 2 months have been very pleasantly surprised at the continued care and seemingly little interruption that COVID presents in the everyday management of their care, of their situation, of their pregnancy, and of their delivery. If you are presenting and you do test positive for COVID, there is an increased requirement for protective gear for the providers caring for you. So if you are positive, whether you're asymptomatic or symptomatic, of course, we will have the face mask, eye shield, and then other protective equipment such as gowns and gloves. We have had some patients obviously positive for the COVID virus. So far, we have been lucky with many of them, all of them doing well. And I think they have been pleased with their care and understand the protection required. And it has been a fairly seamless transition. In regards to our office setting right now, if you present to any of our offices, either the Norfolk location on the EVMS campus at Hofheimer Hall, or at our Virginia Beach location next to St. Princess Anne Hospital, or in Newport News at that location, we all have the same requirements, in that when you come into the facility, you will be screened with the questions concerning the COVID virus, asking you about symptoms or possible increased risk of exposure. We are not at this point in time checking temperatures, but can if there is any concern. Again, people are notified prior to their prenatal care and prior to their visits. We do require face mask or protective shielding of the face during visits, and ask for people that with those, and certainly if you don't have them available to you, they will be provided on presenting to any of our offices. The offices have all undergone following the state requirements in regards to social distancing and to decrease the risk of transmission of COVID. And so you will see a change in spacing in regards to the waiting room and the number of chairs, as well as the number of visitors allowed at any one time. Right now, the office is about 70% back to normal running operations with patients. And by June 1st, likely back to close to 100% with patients receiving care in our offices, as we move now in this stage 1 more away from telehealth and back to in-office visits. With any concerns that patients are having, they certainly can request to continue telehealth, and we are happy to meet those requests and continue those appointments. But we feel that we are meeting all standards to keep you safe and have you return to the regular office visits. And that is up and running and will be back to full swing largely by June 1st. When you present again, you'll notice some shielding at the check-in desk of the with the plastic to protect our check-in staff. You will notice again the spacing in the office, and oftentimes you might see the cleaning staff come through the office as they have increased their efforts to try to decrease risk of transmission, that they're coming through not just in the morning and the evening, but also during the day, constantly wiping down chairs, wiping down door handles, wiping down the elevator buttons and phones, in efforts to try to keep everyone safe. The staff, once you present and get through to either a prenatal visit on the clinic side or in the ultrasound side, you will see us wearing the required face mask and shielding, but otherwise receiving the same care that you would have received otherwise for your prenatal visits and ultrasound visits, as well as your genetic counseling visits. I'm happy to answer any specific questions or concerns that people have in regards to either telehealth or visits within the office setting or within the hospital, and presenting to the hospital through either a triage setting or for delivery at any time. Thank you.
Great. Thank you so much, Dr. Berkley. We are so appreciative to have you able to join us. Thank you for taking the time. And now we'll transition. Appreciate it. And again, if you have any questions for any of our panelists so far, again, please use your chat feature and submit your questions, and look at the questions that are already there and like them so that we can be sure to answer them during our Q&A. And now we'll transition to our last presenter, Stacey Starsman, again, our nurse practitioner who will be talking about breastfeeding and COVID-19.
Hello, thank you for inviting me to speak. I worked in the Hampton Roads area for 25 years before my husband and I moved to the Outer Banks of North Carolina. So I'm very familiar with the area. And I worked there as a labor and delivery nurse, and then as a nurse midwife and a lactation consultant. So I'm pretty in tune with what's going on in Hampton Roads. There is no question that breastfeeding is better for all babies, but I can't imagine another time in recent history when it wasn't this important for so many reasons. It's the gold standard of infant feeding. And unlike infant formula, it provides health benefits far beyond just nutrition. Mother's milk is essential for both the short-term and the long-term health of babies. Babies get an immune advantage when they're breastfed. There's an infection protection that mother's milk offers that formula just can't even come close to touching. And I had a breastfeeding mom, that said something interesting to me. She said, you know, in this time when you can't buy toilet paper,
What if you couldn't get infant formula? And, I mean, yet another reason to breastfeed, and it's free. So it is so important right now that moms breastfeed their babies. Colostrum, which is the early milk that is present during pregnancy and in the first few days after birth, is just such incredible stuff. It gives babies this protective package of immunoglobulins and antibodies and active white blood cells that can neutralize pathogens. It is just really incredible. And that's why it's so important that we do, as healthcare workers, do everything we can to help moms with breastfeeding and to support mothers that are COVID positive and have to be separated from baby. Pumping immediately is such an important part of protecting that milk supply. And doing hand expression actually works even better with colostrum. And the earlier it starts, the better as far as getting more milk volume quicker. So that's something that as healthcare workers, we can help moms with. And Dr. Green and Dr. Mitchell both touched on this, that to date, the COVID virus has never been isolated in breast milk or in amniotic fluid or placental tissues or cord blood. But it's very important right now that babies get their mother's milk. And something that has been troubling me as a lactation consultant and as someone that's taught childbirth education classes, that people are having a hard time accessing classes. And I saw someone ask a question there in the chat about that. I have been doing some online teaching, and I have found several classes that are $20 online that are very good classes. One is called Milkology. It's a recorded class. It's self-paced. It's about 90 minutes long, and it costs $19. Another class, and you can find this one on Facebook, it's called Feed Your Baby University. And it's a live class taught by Heather O'Neill, who is a nurse midwife in an IBCLC. Actually, she and I went to the same school, nurse midwifery. And that was $20. And you can find Feed Your Baby University on Facebook. When I teach breastfeeding classes, something I always stress to new parents is that you want to stack your deck and you want to up your odds of success. So one of those things to stack your deck is to take childbirth education classes and to take breastfeeding classes. And often they are two separate classes. I've been doing some research into childbirth education classes. I've found some very expensive ones and that are recorded. And I'm hoping that Cynthia hopefully has some childbirth classes too. The other important thing is not only to take a breastfeeding class, but to join, before you have your baby, prenatally, a breastfeeding support group. Here in the Outer Banks, I actually lead a breastfeeding support group. And we usually meet once a month in a coffee shop, and we last met on March 6th. Our first meeting after everything shut down was on April 15th as a Zoom meeting. And the enthusiasm and the connection, these mothers who already knew each other, was just so incredible. Because moms are so isolated right now from one another, just like we all are. And to be able to talk to other mothers and to, connect on the internet, and that's such a resource that I think that we need to make sure that we lead moms to, and that parents find, because it does help you stay connected and educated. And this won't last forever. It just feels like it right now. So I did that one Zoom meeting for the Breastfeeding Bistro group, and I asked everyone, when would you like to meet again? And they all said next week. Long story short, tomorrow's our 6th week in a row of having a Zoom meeting, because the mothers are enjoying so much being able to talk to their friends. And we do talk about breastfeeding, and sometimes they just kind of talk about a lot of other things too, and that's okay. But that's my little part that I can do to help prevent postpartum depression in the pandemic. I'm going to do it. So knowing Hampton Roads the way I do, I know that all area hospitals in Hampton Roads employ lactation consultants. on their postpartum units. CHKD as well has lactation consultants there, and several pediatric practices have lactation consultants. Normally, when you have your baby in the hospital, the day of sometimes, but more often than not, the day after your baby is born, a lactation consultant visits you there in the hospital and does some breastfeeding education and just make sure that things are going well. I know that I personally have done several FaceTime lactation consults for new parents. And if they are really struggling, I mask and gown up, and if they're comfortable with it, go to their homes. So I've personally done that. I'm not sure what other lactation consultants in Hampton Roads are doing as far as that goes, because sometimes moms do need some hands-on help. One of the positive results of all the changes that are going on, one of my postpartum nurse friends recently told me that with the limited visitors after delivery in the postpartum rooms, the parents are having this wonderful uninterrupted time with their new babies. So they're seeing fewer missed feedings and delayed nursing sessions under this change that's happening now. It's just a little silver lining. Other resources for breastfeeding are if you're enrolled in WIC, your local WIC office at your city's health department, they have peer counselors and lactation counselors that are very, very helpful and can help if moms need a pump as well. But in this ever-changing world of COVID recommendations and advice, I know that every lactation consultant I've ever met will work to do everything within their power to provide the most accurate answers to your questions if you reach out to them. So be sure to learn your resources and use your resources. And that's something that's more important to do prenatally before you deliver, so that you know who to reach out to if you do have problems and you do need help in that connection. And since I'm the last speaker, I just want to throw out one message to parents that are listening to this talk today. And that's, you're having a baby. This is such a wonderful time in life, and it's so special, even though we're going through all this COVID stuff. And it's just a chapter in our lives, and it's going to get better. And if you're doing all the things that you can do to protect your family and be safe, you're going to be fine. So this is one of life's greatest moments. Celebrate your baby.
Great. Thank you so much for that great presentation. And Jane, would you like to start facilitating the Q&A?
Absolutely. So I want to encourage you, if you do have questions, we have got some great experts on our call that are happy to answer them. I want to thank all of you for your great presentations, and Stacey, I think, for reminding us that this is an important time, and to really focus and celebrate on the happy times and the birth of the baby versus, the stress of the other pieces. So we do have a couple of questions. I'm going to encourage folks, if you have questions, please type them in our questions and answers box. And or in your like box, your comment box on Facebook, we're monitoring both of those. So I'm happy to address them. So our first question, Carrie asks, and maybe Dr. Mitchell or Dr. Green could answer this. Carrie asks, what precautions should parents take when friends and family come to visit the newborn once they're at home?
Dr. Mitchell, I'll go ahead and take that. Yep, this is Dr. Mitchell. I'll go ahead and take that. It's the standard precautions. We need to be diligent. Yes, we're in phase 1 and relaxing, but there's still a fair amount of asymptomatic disease out there. So the ideal is no visitors. Practically, that's tough. Practically, that's probably a little bit unrealistic when there's a newborn. I don't plan on completely distancing like that when I have a new grandchild this summer. But you have to be very cautious. You've got to do the distancing, you've got to make sure that only visitors that are totally asymptomatic and have no other exposures are coming anywhere close, because we just don't want to take the risk of anybody getting sick if we can avoid it.
All right, great. Thank you. Go ahead, Dr. Green.
Yeah, I just wanted to add that, as we've already been talking about over and over again, again, the same thing if someone is visiting, that you have the precautions for asymptomatic folks, but you need to wear the mask, and you do have to do the careful hand washing. That has got to be paramount for any kind of contact with your newborn, for sure. Thanks.
Great. Okay, so we have another person that's just to clarify, if the mother tests positive prior to delivery, can she still have the dad with her during delivery? She felt like it would be good if, so that the dad can help with the baby if mom has to distance herself. So I'm not sure, maybe Dr. Berkley or Teresita?
So is this, I think the question is, if a patient is positive for COVID, whether they have symptoms or not, what is the hospital requiring or allowing regards to visitors? And my understanding right now is that if you are COVID positive, regardless of whether you're symptomatic or not, it is no visitors. Correct, Jerri and Teresita?
Yes, that actually is correct.
And so, unfortunately, I know that can sound scary to not have your support person, in theory, with you at the hospital. But those are somewhat national guidelines because of the likelihood of surrounding individuals having been exposed, and to decrease the risk, if they don't have it already, of them also getting the COVID virus. We have had some certainly people presenting and delivering that were COVID positive. I think they would happily respond that the care they received was excellent. They were comfortable in the setting of the delivery and felt like we were all very supportive of them and providing what they needed in regards to support and help in getting through the labor and delivery process and the postpartum. And I think they all did very well and were quite appreciative of the care they received.
And as it stands now, if a patient is tested positive for COVID at the time of delivery, the baby is separated, as Dr. Green had mentioned earlier, from the mother to ensure that the baby does not test positive for COVID.
Great. And Teresita, do you want to speak to a nursing perspective on how you support, how you would support a woman who might be having to be isolated during that time?
Yeah, like Dr. Berkley said, we have had that occur, and what we try to do is do a lot of FaceTime with their families. Sometimes the patient has like 3 or 4 phones, and a lot of support, and then we do a lot of extra care with the nursing. It's not any different than what we already do, but we do try to make sure they feel supported and loved, and their wishes are what they want to have happen. Like a birth plan, we still try to go along with that and ensure that that happens for them. But we do give them a lot of good support and nurturing. It's nothing like your family, but we sure step in to be their family when there's no one else can be there.
Great, thank you. And then a question for Stacey. How long should I breastfeed to keep my baby from getting COVID or other illnesses?
The recommendation from the American Academy of Pediatrics, Okay, I'm unmuted. I want to make sure. Is that you breastfeed your baby exclusively for 6 months. Then you continue to breastfeed, and then there's the introduction of food at that time. And then you breastfeed your baby as long as it's working for both of you. It's certainly fine to nurse longer than 12 months. I think that COVID's going to be around in our life for longer than a year. So the longer you can breastfeed, the better. I've actually had mothers come to me to relactate that had stopped breastfeeding and wanted to start again.
All right, thank you. And back to the question on the availability of Lamaze classes and or lactation consulting services during the pandemic setting. So as Stacey said, there's some online options. You can also contact your hospitals and they all have lactation consultants available. But somebody did share that Centera Careplex and Hampton Healthy Families are starting some online Zoom birth education classes on Zoom in June. So we will follow up with Centera to see if that's what might be available on the South Side. Also with Chesapeake Regional to see what they're offering, and we can put that on our -9 to 5 Facebook page with our other resources. And one more question. Can you review the separation procedure between a positive mom and a baby? How long would that typically last?
Well, as we had talked about already, so Dr. Green, that separation is going to last, as we said. If mom is positive, then she will need to have no symptoms, be afebrile, meaning no fever, even, and that means no antipyretics as well. Then she has to have 2 COVID tests done that are 2 separate tests, 24 hours apart, and then she's negative for all of that. That's when we would then say then that mom could then be able to be with the baby. Now that's the situation where we have the separation. Again, there's very limited space sometimes in certain facilities, but if you are not separated, you still have that 6-foot barrier, and you still have that the either an incubator type system or some kind of a sheet or really plastic sheet of some kind separating the baby from you. So it's still a separation, and that's going to continue on until those 3 things are done for mom, so that she will, again, we do not want her to give that virus to the baby. I hope that helps.
Great, I think it does. So somebody else wants to know if OB offices will be offering antibody testing in the future. So Dr. Berkley, I'll let you take that one.
We have not, there's no firm decision yet on antibody testing at this time. We are not offering it right now. We continue to look at the data and the possible scenarios of offering it. But through our offices, we are not offering it. Each OB private office is probably deciding on their own, but receiving guidance from societies like ACOG and SMFM on these decision-making inputs, but at this time we have not been offering it.
Great, thank you. And this one I think goes back to Stacey. Are there breastfeeding classes we can take prior? She says, I'm a little bit nervous to just wing it on the day of. Yeah, I think very common feeling. So I guess the question is, where might one look for resources and classes? And then secondly, does my insurance cover lactation consultant service? I didn't know much about that. And will my insurance help pay for that? Needed.
So under the Affordable Care Act, Most of the time, lactation consultant visits are covered. Being a nurse practitioner and working in office, I'm able to bring in lactation patients for lactation assistance and bill their insurance. And I have not yet had anyone not covered. But as far as finding classes, and I strongly encourage you to take a class. I think that's a great idea. I wrote in the little chat and answer, and I did speak to 2 classes that I found that are good classes. Milkology is one class you'll find online, and that's a 90-minute recorded class for $19. And I don't know if your insurance will cover classes, some do. And Feed Your Baby University, you can find that one on Facebook. And that class is a live class. In fact, she's going to teach it again Friday evening. It's $20. So those are good options and a great way to get that breastfeeding education before you have your baby.
That sounds like a prepared mom there who's looking to take that. So I don't see any other questions, but I'm happy to wait just a minute to see if other folks have questions that we can answer. I did hear another question asked earlier in a conversation earlier today with folks, and the question was around oral health and dental visits. And somebody wanted to know if pregnant moms should, if they're having a dental problem, is it safe to go to the dentist, and what should they do? So we reached out to Health Catalyst and got an answer to that question. And yes, it is very safe for pregnant women to go to the doctor and get oral care, have dental cleanings. The best thing that we can do right now is recommend that call the dentist office and follow their procedures. They're all in the same process of reopening as others have done. So that's the recommendation there. But we will wait just a minute to see if we have any other questions for moms or dads.
Yeah, Jane, on the event chat, there was one question from Dr. Stephen Warsoff, and if I can read that, is that okay?
Yes.
Okay, and it's if President Trump is taking hydroxychloroquine, are you and should I? Is Dr. Berkley still on? I think we might have lost.
It looks like we've lost a couple of folks. Dr. Romero, maybe you can address that as a family physician.
Yes, I would say the science is not demonstrating effective treatment at this time, but there are many clinical trials that are taking place as we speak. And so I would say, personally, I would not be taking it, and I probably wouldn't recommend it at this time until we get stronger evidence of efficacy. But two other points I would make is that number one, hydroxychloroquine does have some harms, particularly related to irregular heartbeats and actually leading to some fatal heart irregularities. And also there are many conditions that are actually treated appropriately with hydroxychloroquine, and those are probably the patients that should be receiving the hydroxychloroquine for their other medical condition like lupus, et cetera. And we would probably not want to have coverage for people trying to take hydroxychloroquine when there are actually individuals that need it for true evidence-based medicine.
Thank you. Just trying to check to make sure if we have any other questions. I know there were a couple on Facebook that we have answered, but just want to make sure we have not missed any. All right. Well, I'm not seeing any other questions. So I just would like to thank all of our panelists who took their time this evening to share the information. And more importantly, we'd like to all attendees who took time out of their evening to listen to our panelists, learn everything that they can, most up-to-date information. We know that this information is changing about every other day, and so hopefully is the most up-to-date here. I did just get another question that popped up. Okay, actually there are a couple. I'm sorry. So we'll go back to those questions. Are labor moms required to wear masks? No staff are, but our mom and dad.
I think I heard you ask if mom is required to wear a mask or if staff are required to mask. Okay. Everybody is required to wear a mask. That's for everyone's safety, both the patient and their loved one, as well as the staff. So when the nurses come into the room or any healthcare provider come into the actual patient room, both the patient and their support person should have on a mask. When we leave, they can take their mask off.
Great. So next question. Recent studies have reported that, or reports suggest that there may be COVID-19 induced placental infection. Can you comment on that? May Dr. Berkley?
Sorry, could you repeat the question?
Sure. Recent studies have suggested that there may be a COVID-19 induced placental infection. Can you comment on that?
Thus far, we have not seen, even in the patients testing positive for COVID for us, any changes specifically in regards to the ultrasound or the appearance of the placenta at delivery. So I can't comment on the newest studies and whether there is a true risk of infection and whether it's being detected in the placenta. We aren't seeing it, at least on our ability at this time. But I think more studies are warranted. Certainly nothing that we've done preemptively looking prenatally in people that are COVID positive has been shown on ultrasound. In regards to typical infections out there, typically when you have an infection that's at risk, that mom has at risk to pass to the baby, that is concerning. There are marked changes at the placenta that can be seen on ultrasound in regards to the size of the placenta and the blood flow. And we have not been detecting those thus far on COVID patients. And in my understanding, that hasn't been seen in Europe or in Asia either, but I'm not certain of this newest study that the person is reporting, that perhaps there's some biological studies on the placenta through the pathology departments. I have not seen those to date.
And one additional question, or I'm sorry, two additional questions. When do you expect significant others to be allowed for doctor's visits? And I'm not sure whether that's OB appointments or pediatric appointments. So maybe Dr. Green or Dr. Mitchell, as well as Dr. Berkley, could address that.
Certainly for the obstetric appointments, at our facilities, I know through June 1st, we still are under the policy of no visitors. That is probably going to continue, certainly through phase 1 of the state reopening, but it may continue throughout the summer, depending on concerns for a recurrence or upsurgence of COVID later in the summer. So at this point in time, we do not have a plan for reopening the office for visitors, largely just to continue for the patients' and staff's safety, to maintain social distancing. And right now it's limited based on social distancing needs and following state regulations. The spacing that is required within someone's office facility only allows for a certain number of patients, such as, for example, in our Norfolk office at Hofheimer Hall, our waiting room based on spacing would allow for 26 people to be in the waiting room. And so it's hard at this point in time to allow people to have visitors, however significant that may be, as support with them, because it would decrease the number of patients allowed to enter and decrease the number of patient visits we could provide during a day.
Great. Dr. Green or Dr. Mitchell, any other comments on that as far as for
can you hear me?
Well baby appointments?
It's Dr. Mitchell. Can you hear me?
Yes, we can.
Okay. Within the hospital, if you're needing to seek specialty care or go within CHKD, it's limited to one visitor as well, one parent with the child. In the general pediatric offices, there's a little more flexibility to that, particularly with a newborn, and certainly be acceptable for both parents to be there. We don't want it any more than that. Sometimes we used to have a couple of grandparents along for the ride and other siblings, and so we'd like to limit it to the newborn and one or two parents. Again, for those same safety things, with everybody masked and making sure that nobody that is sick is along with them for the visit.
All right, great. So an additional question, are there additional risks for high-risk pregnancy, specifically preeclampsia? So Dr. Berkley, if you've got a patient with preeclampsia, is that person at higher risk? Should they get COVID-19?
Well, let me answer that in two ways. One, we are not seeing that at this point in time that patients that are positive with COVID are at higher risk of pregnancy complications. So if you test positive for COVID in your pregnancy, whether you're asymptomatic or not, we have not yet seen a significant increased risk in developing preeclampsia and developing preterm labor and developing premature rupture of membranes and those sorts of complications. Now, if you have predispositions for things like preeclampsia, many of those patients have that increased risk to develop preeclampsia because they have heart disease or diabetes, or two of the risk factors that would increase your risk for getting preeclampsia. Those similar patients are at risk, at increased risk for complications if they develop or if they contact and get COVID. As we know from the non-pregnant patient population, the people that seem to do poorly are those with these underlying medical conditions of severe hypertension or heart disease or poorly controlled diabetes. And so there is some interplay or some potential risk there, but specifically we aren't seeing that the COVID increases risk for pregnancy complications. But if you have pregnancy complications and develop COVID, your underlying health issues might put you at slightly increased risk for poorer or prolonged COVID course or poorer outcomes. However, the newest studies coming out, I think one was just released again today, saying that pregnant patients are not across the board at increased risk for being high risk for COVID or high risk for COVID complications all in all. And some are surmising that perhaps there's some protection because of the immunosuppression that pregnancy offers. There might be some element of protection in pregnant patients from the more severe COVID conditions.
Great, thank you. Okay, so we've got questions are now starting to come in a little more frequently. So if
Jane, can I jump in 1 second?
Sure, absolutely.
I was trying to answer earlier, and my I'm having a little bit of connectivity issue, but I wanted to readdress. Someone had asked earlier about the antibody testing, whether we were doing that in our offices, and we aren't now. And I wanted to kind of readdress them that question, because some people might be asking, well, why aren't you doing it? Wouldn't that be reassuring? There are a lot of different antibody tests out there on the market already. We're not sure that all antibody tests are equal. And right now, because COVID, we're learning so much every day from it. We do not know, just because you have COVID, that you now, if you test positive for IgG, that would confer immunity. It's not 100% known. So at this point in time, I think that's why some of the societies are holding back on saying, let's offer everyone, at least in the OB world, antibody testing at offices, because we're not sure, just because you test positive that you had it in the past, that would 100% make you immune from getting it in the future.
Great, thank you, Dr. Berkley. Appreciate you circling back on that. So we have another question that says, if the mom is an essential employee and has to go to work, is that really dangerous, or should she just continue to go and be as careful as possible? So I think Dr. Berkley or Dr. Waller probably can.
I'll let Jerri hop in on that one.
So I think, as far as pregnancy and the coronavirus, like I mentioned before, there's no studies that have shown that pregnant patients may be at increased risk of developing the virus or at higher risk than the general population. With that being said, certain practices or workplaces may have certain policies in place for pregnant patients, employees with immunocompromised states, or those with elderly workers as well. I think that it's important that if it is necessary that a pregnant person work in this environment, that they are taking all of the necessary precautions, good hand hygiene, wearing masks when possible, staying socially distanced from people.
All right, great. So another question, is there a recommendation on when expectant healthcare workers and providers should come out of work or stop seeing patients face-to-face?
I'm sorry, can you say that again?
Sure. Is there a recommendation on when expecting healthcare workers or healthcare providers should come out of work or stop seeing patients face-to-face before their delivery? So, Dr. Berkley?
Yeah, I have not seen any direct statement from the obstetrical societies, whether it's ACOG or SMFM, regarding this specific question. So if you're an essential worker, especially in a hospital setting or in any setting where you're at increased risk of exposure, when should you stop working? in theory, to decrease the risk of becoming, exposed to COVID or developing, getting COVID. Sorry, I'm having connectivity issue again, but there is nothing to my knowledge out there telling us, at any magical week, that's when you should stop working, whether it's 34, whether when you hit full term. We've largely just been guided on a case-by-case basis on how significant the risk is, the need to work, and time off that's allowed through legally and through their job, and trying to come up with the best answer for each patient individually.
Great. Thank you. I think, Teresita, you might be able to answer this next question. Are there dedicated personnel in labor and delivery for COVID-19 staff to help prevent transmission to negative pregnant patients?
So that's a good question. When we have a patient that is COVID positive, we try to keep that nurse one-on-one with that patient, and that's how we do it. We don't let them mix with other patients or come in and help other people. They usually are dedicated to that one patient.
Okay, great. Thank you. Another question says, do we have any statistics on the number of laboring women who have tested positive for COVID? How many newborns have tested positive, and what are your recommendations for supporting the new family safety in regard to social distancing? So I would say Dr. Berkley or Dr. Waller maybe can take that.
So obviously the percentage of people testing positive is different based on location. In general, in our area, there are reports that in people coming into labor delivery facilities for their inductions, in labor, or for C-sections, and now that we're screening everyone, of course, we're seeing more positive cases. Probably not an increased surge of COVID, but rather an increased testing. There is roughly about a 10% positive asymptomatic, let's say asymptomatic carriers that are positive for COVID. That's what's being reported in our region. I don't think at Norfolk General that we've specifically seen it that high. We certainly have had cases, but I'm not sure that we could say 1 in 10 people is testing positive. Certainly when I've been on, that has not been the case, but that's what's being reported out there, somewhere around a 10% asymptomatic carrier rate.
Great. So a provider that works with she's a postpartum doula, and talks about many of her clients are have concern about depression and anxiety after the birth of their baby. Also, they are a little bit frightened by the thought of having to labor with a mask on. So I think those are all interconnected. Somebody would like to know, will the EVMS office in Virginia Beach open back up in June as well? I was last informed that all appointments would have to be in the Norfolk location. Dr. Berkley, do you know when
our EVMS office earlier was, doing largely telehealth. But it has opened up. There are some visits within the Virginia Beach office, and that will be increased throughout the month of May into June. And I would say by the first week, or certainly the second week of June, they will be back to full running operations there. If you already have a health visit scheduled, they are keeping that, but for most new prenatal visits, they will be scheduled as a as previously normal in-office prenatal appointment.
Great. And let's see, Rose Miller asks, is there an increase in vasculitis cases in PEDS patients? I'm not sure, maybe Dr. Mitchell, if he's still on the phone, might be able to address that.
Yes, I'm still here. Yes, there's certainly the reports of the Kawasaki's disease, toxic shock syndrome, pediatric multi-system syndrome, variety of names, being investigated very hard, very fast. We've had none in the Tidewater region so far at CHKD.
Great, thank you. I know that's a big concern for parents as well. Okay, so I think maybe our last question of the evening is that somebody shared that they had read an article that OBs noticed an increase in fetal demise and stillbirth in second and third trimesters for COVID positive mothers. Has MFM seen any increase here in this trend? Dr. Berkley?
I haven't seen that. I haven't seen that in the literature either. Most of the literature I've seen has not shown an increased risk of stillbirth or miscarriage secondary to COVID. Obviously, I think it's hard to make definitive statements on this as the virus is still ongoing and it's so, data is still being collected. I think only time will tell us the true answers. And looking back, in a more epidemiological way at what is the yearly rate in our region and statewide and nationally of stillbirths, and then looking at the time when COVID came in, whether there was an increase. But so far in the literature I'm seeing, it hasn't been reported, and that's coming out of looking at literature in Europe and Asia as well, not seeing increased risk of stillbirth or miscarriage.
Great, thank you. I'm sure that's very reassuring to our pregnant moms out there. So I know that our time is up. We have past our 8:30 stop time. It does appear that we've answered all the questions that I am seeing. If we go through, as we look at all the different recordings, if we note that there are additional questions that have not been answered, we will certainly provide a typed answer sheet and put that on our -9to5.org COVID resources page with information for families. We do encourage families to go and look at that website. It will also direct you to the EVMS page and more information on the Brock Institute page as well. So again, thank you to all of our presenters, and thank you to all of our pregnant moms, dads, and families who have joined us tonight to learn more. And as Stacey said, I think really just focusing on celebrating your baby and taking care of yourself and your family right now during this exciting time. So we greatly thank you, and I'm going to let Dr. Romero finish with any final notes.
Great. Again, I also want to add our deep gratitude and thanks to our local expert panelists for their very informative presentations and answers to your questions. Also want to thank our EVMS AV specialists for supporting this virtual session. We especially want to thank you, our audience, for joining us tonight. We hope this session was helpful for you to have healthier pregnancies and families during this pandemic. Stay safe and be well. Good evening.
The event has been paused.